regular. Fortunately, no, President Yenya NHIS Boss no man, so I mean no any incomo. Now for so Dr. Aboagye Da-Costa, or CEO of the National Health Insurance Authority. Doc, akwa be ko si saying so ni.
Hello.
Doc, what you mean ka? Hello.
Hello.
Yeah, Doc, me ba cho what you mean ka?
Aha,
metonka pa. Apomu ye de. Okay. Enti boyemu kakra na ye ne kidney patient one association president na AD Enkomo na wamaye ehu the details of promise are buying through the NHIA moye efa won dialysis treatment no eho details no etesen from mo end me pacho.
Okay, me that I'm going to start with kidney story. Na me ntia Ghana for na me pase say aban I na say the global for the so you know and the bottom things around him and yes that's a pilot na pilot na start professor in from almost committee no no I think that almost associated about 600 patients. Hello?
Yeah, maybe I told me too, Doc.
About 600 patients.
Yes.
But the actual no numbers were about 400. In the actual studies with it. Your consultant be or UK in Aboagye
Asempa.
Yes, actual model no. Now 24 patients per 1 million population. That's the prevalence rate. What Ghana has say. Now because actual we can say 400 no. Say so the ANC we can only go by the fee now. Parliament are approving of.
Yes.
So Parliament are approving, I think 495 or 490 thereabout. And see, so you 400 no. Number of 3 scenarios. In here, you team say you name say bit me I support dialysis for no from the 1st of December. We share 400 now. So they multiply 490 by 8. And now 495 now you will get around 1.5 million per month because there are 8 sections.
Okay.
Then that will give you that for 12 months that will give you about 18 million. Okay. Now we have second scenario say okay, so who run it out? Let's all double number now because bear in mind this is the actual now. The double number now, it will come to about 800 or 840. Now, what they also multiply 495, now they multiply by 8 now. That's the 8 sessions now. It will give you about 3.5 million.
Okay.
Now they are multiplied 12 months. That will give you about 40 million. Thereabout.
40 million Ghana cedis.
Yeah, 40 million Ghana cedis. That's twice. So that's scenario 1 near 400.
Okay.
Scenario 2 near 800.
800. That's why we have 2 sessions a week.
No, yeah, only 2 sessions a week.
Okay.
And scenario 3 near 1,200. That is where you can say.
Omoya 3 sessions. Omoya 3 sessions a week.
Our dialysis next one.
Okay.
And no, and also they multiply 490 no, now 495 no, by 8, you will get about 4.85 million. Okay. Then if you multiply that by 12, that gives you 56 million. So scenario 1 will give you 18 to 20 million. Scenario 2 will give you 39 to 41 million. Scenario 3 will give you 56 to 58 million. Okay.
Okay.
Now, Oshe yen budget now on 2016 till now, you are grown by sixfold. So it means 1.2 billion in a 2016 way. The budget is 6.8 billion. Bear in mind that we have been capped at 20%. So now, if you are capped at 20%, now you see 20%. No, at the work is 6.8 billion. You get about 1.3 billion extra funds.
Okay.
You see, you get it?
Yes.
Because we've been capped at 20%, so it means 20% of our money is not given to us. So now, if you use that 20% for the 6.8, now you get about 1.3 something billion. Okay.
Yes.
So if you look at that amount of money compared to any of the scenarios now, and yet because these are additional funds that will be coming to the to be coming to the NHI. So government can even decide to say that, okay, we've now capped you at 5%. We get 15 of that 1.3 billion. You get it?
Yeah.
And let me say that, you see, Dr. Aboagye is very deep. So we had a conversation with him. We showed him the data. We're all trying to find solutions to how we can obviously sustain this dialysis.
Doc, maybe I don't catch you, Mr.
Dr. Aboagye is very deep.
Okay.
Because you see, you didn't have a meeting, and we were trying to find a solution to how we can obviously support this dialysis and other chronic diseases. And when I saw statistics, we were in a PA. And I say I didn't insignificant on our budget, because at the end of the day, bear in mind, I've told you that the prevalent rate is 24 patients per 1 million population. Working it out, I gives you about 1,250 something, 1,250, which is equivalent to the scenario 3. But it's not obia or kidney disease we are in a dialysis. So you move to scenario 2. So at least 2/3 of a kidney disease, no, about dialysis. Then that comes to about 800. That means that the amount of money we will need per year is 40 million. 40 million out of 1.3 billion. It's a whole lot of, it's huge.
Yes.
So I think now what we have to do and what we are doing is to expand the centers. So the new nephrology unit now, yes, you are.
Yeah, Doc, wa home na bad, me pacho. Baby, I know na yeah, I think it's better now.
I say now what we have to do is we have to expand the center so that people will not have to be crowded in Korle-Bu, Konfo-Anokye 37 police hospital and other places. In future, the new nephrology
hello, Doc. My name say one kwan so mood too kwan there. I don't know, but no, it's still bad. It's still bad. Baby, I know ujina na ye. My name say mbetimi too kwan there. Anka mbetimi park here, mami anka be me de nanka wi a matwa so.
Okay, but that's me ngata.
Yes, it's better. Anka ujina here, mami. Yes.
Okay. So I was saying, the new nephrology unit na yes in Korle-Bu no. They are providing you with new dialysis machines to support that. And NHIS, any World Bank, a project B, you better procure more dialysis machines and facilities. Today, as we speak, the Agenda 111 is also ongoing. Dr. Aboagye say the Agenda 111 hospitals, no, they be completely a should have dialysis unit in there in such a way, in Korle-Bu, any people will not come and congest, let's say, Korle-Bu, Konfo-Anokye, any other places, no. And we have a well thought through plan, executed. The third point, so you see, already you cover acute renal disease. NHIS covering that.
Okay.
And as I say, I be pilot higher than account. And what is going to happen is that we should now focus on prevention. Now, NHIS are launching what we call the annual health check. The annual health check will check diabetes, hypertension, body mass index. In fact, doctors Nebeka said this renal disease is a kidney renal disease is a hypertension, diabetes. And once you use preventive approach, that becomes your test strategy. Then not the final stage, which is the transplants. Now Menoka say you develop policy of like organ and tissue policy.
Okay.
And also, but Otomenka.
Mitiopa, doc.
You develop this policy now to see a stakeholder consultation. UGMC offer and go for three other places eba be kidney transplant ne home konyaba. And I think say our 4 points agenda for comprehensive where cancer, chronic and dialysis, renal kidney disease eba boa Ghana for be brave. Now let me come to something. I've heard so many things say. Obviously, one political party, we saw Mayor Mahama Kell said,
now me clarify baby, and then I'll do that comparative analysis in the two manifestos. We'll do that. But now me person me busa say we share actual studies are more on this dialysis treatment now. More factor in private hospitals on service providers Ediama NHIS. Even in normal hospitals.
Absolutely, yes.
Okay, private hospitals they can.
Yes, Obia can. My credential meaning I can. Say, you see me this started with the prevalent rate of dialysis patients per million population.
Okay.
As we speak, so you see prevalent rate now almost 1,250. Almost. Now you see a scenarios no quite to the offer the minimum to the maximum. Maximum there is 1,200 and we know.
Okay.
Now minimum near 400. And you capture and you also capture say maybe even as we go along so many people are omokrano siki care ebeba. But I've told you where we're going to get the money from.
Yeah, you've made that point. But the other thing is, it is a obi private facility. Unsi enim say private facilities ni be charge a bit higher as in Kolebuni other public facilities. No, it no how much would the NHIS pay to the private facilities?
Okay, the good thing is that we regulate the private facilities.
Okay.
In fact, we do their tariffs together. NHIS, you know, we have tariffs, no. And normally they take guidance from tariffs na diabano. Then maybe so we will definitely work with them. Like I said, because we credential them, we regulate them. So but at the moment, no, what you should note, say the only approved price are buying the Eco Parliament the approve
yes.
basing on no studies. No.
Yes, that I agree. And I think one thing about many president conversation, say even if a private facility be credentialed by NHIS, but they be more of the renal cases. Afe and NHIS Ejiatum say they would fund. And here from 1st December, my imagine they want to jump on board. Omo charge be 1,000 per session, but Parliament approve 450 per session. Edi ama Sa 450 no and
you have to go through a whole lot of processes before you are credentialed.
Okay.
And sorry, I now say open so by NHIS on do have to so no.
Okay.
Legal obligations and other regulations that you have to meet. And see, I can tell you that will not just happen just like that. But what will happen is that we'll take them through the process, do the inspection and everything before we accept them.
You accept
and
them.
like I'm saying, the fees are on the charge, Normally, any and yes, will be able to say, okay, may charge you with that or cannot charge it. And yes, I
Okay. The other thing in so and say, based on more actuals, we are watch only a channel, meaning say every patient, 2 sessions per week, right?
Yes.
Obi here additional session, and there was no idea.
No, you see, there must be a standard at some point. You see, so even if you look at your treatment, your standard treatment guidelines. Okay,
yes.
So if you use the standard treatment guidelines now, for now, I know say you use 2 sections, and for your friend is saying some people may need more, and if they make the case, definitely we will be able to assess and see the quality. We call the department quality assurance. They can assess.
Okay.
But you see, the good news about this program, they say we have done a pilot with the actual numbers,
yes.
and we know those on the list. Do you get what I'm saying?
Yeah.
Yeah. So all we have to do is see a person may crowded or the other facilities to say 37 police hospital, other places near support you more with dialysis machines na World Bank project na it's a comprehensive talk through plan.
Very well. Now, I mean, looking at sustainability, because we are in the campaign season, no, some will think, so okay, something juicy to the electorate, Bema or Matuaba, Ediama MPP. But let's go to my manifesto. No, so I'm 2024 NPP manifesto highlights now. The one Dr. Baumia presented, the point number 7, it can provide better health care for all. Complete all Agenda 111 hospitals. This ensures every district gets a district hospital. Number 2, recruit more doctors, nurses, and other healthcare professionals with improved conditions of service. Number 3, bring healthcare services to your doorstep by A, completing the digitalization of public healthcare institutions under the e-health project, scaling up telehealth services, establishing 2 additional sites in addition to the existing 6 at Funsi and Kintampo to enhance drone delivery services to ensure total nationwide coverage, ensuring the interoperability of the National Electronic Pharmacy Platform with public and private healthcare facilities, offer incentives for healthcare workers to buy 1 vehicle each with engine capacity of up to 1,800 cc and ensure compliance with the existing deprived area incentive package for health services. Into when under the highlight of the manifesto, so NDC for the doc on healthcare almost highlights now. They have a specific point under. Okay, into the next NDC Mahama government will 1, uncap the National Health Insurance Levy and ensure the timely release of payment to service providers and additional funds to finance healthcare for Ghanaians. 2, establish the Ghana Medical Care Trust Fund into bracket Mahama Cares to support the cost of healthcare for persons with chronic diseases such as kidney failure into bracket dialysis, cancers, sickle cell disease, diabetes, hypertension, and heart diseases. Number 3, Omoka implement free primary health care from the CHIPS compound to the polyclinic level in the short to medium term. It really the broad strokes no under Omo health no, and you can see say they've been very deliberate in dealing with chronic diseases, kidney disease, eka who compare 2 manifestos now? So when you MPP, which one would you have voted for?
Okay, Obi, I'm sure. You see, luckily, I was a member of the manifesto committee.
Okay.
And just go to the NHIS portion. I'm sure there you will see what we call automatic price adjustment in economics, and I'll show you why we have uncapped based on economic models or economic principles in our manifesto. Just that maybe we've used some words that maybe people might find difficult to understand. But basically, if you look at the NHIS component of the manifesto,
yes,
it talks about the automatic price adjustment, and in the economics, it's really detailed. Now, let me take my time to explain. You see, we have noted that obviously there are systems reforms that need to take place in the NHIS. And one of it is yet Scaneba, a core GRE, we are a consolidated account. A consolidated account we are na finance minister I issue warrant or issue warrant new year and some controller at transfer scanner the amount. Sometimes there is no money for controller to give to you. So there are a lot of complications. So when we sat down, we said that okay, under the flat tax rate of Dr. Baumia, the levies will be separate. within the flat tax.
Okay.
So the levies would go directly to the GRA, then it's transferred to the NHIS account. Now, once that money is transferred to the NHIS account, basically the uncapping is gone. You get it?
Yes.
Because you are getting full amount of the money.
Yes.
That's why if you look at my first calculation, I said that we have been uncapped at 20%. So if you uncap, then what this means is that you are getting additional 1.3 billion. So now it's up to NDC to tell us where they will be getting their funds from.
For Saomo Mahama case, no, right?
For the Mahama care, but let me make a point. You see, any fund that will compete with or that will be in competition with the national funding or which is the NHIS funding will collapse the scheme. And that is how I see here. So the president of the Mahama Care is really dangerous. You see, maybe they are just copying from America saying Obamacare, but their form of financing is entirely different. So you see, we need to understand. Now let me go to the second this thing. The second point was the automatic adjustment that I talked about.
Yes.
You see, in our act, it says that we should obviously review the tariffs every year. That is causing problems, and that is causing co-payments. So,
Asempa FM.
We need to do it like we do in the full, deregulation. So, in such a go up, then there is a National Tariff Review Committee. That National Tariff Review Committee will review the tariffs and apply it appropriately. By this, you do not wait for, obviously, like on train say, your friend say, like it will be any prices now. Why we kind of say prices now? Inflation, winning you take in a market price, and you take all into consideration.
Yes.
And to be able to every time, no, you'll be giving the pharma companies and the facilities what they want or what they deserve. They deserve. And to be able to see a patient in the core facility now, because of this automatic price adjustment, are more full cost recovery. No, in the almost charge now input. The third level in a year the e-pharmacy na yediabano. So e-pharmacy ne so say the Oko hospital ne say doctor ne throw prescription ne mahwa. Ye be ma pharmacist no atro the Oko hospital ko mutimi ka throw that drone bi ni wo kokoto baby. We were NHIS, we have paid up to date to the extent to see am no ka say yeah part health facilities no for claims here the Embra. And then the second me claim boss the over SM approve no. Only 50 million per normal submitted, but normally it's about 200 claims. So, which means that the insurance is back on track. But the fact of the matter is, with this e-pharmacy, no, now patients know even the prices of the medicines. And so, oh, okay, about 500 of the medications, no, are covered by NHIS. And it's my platform, so our medication will be or pharmacy way. The other thing, direct me to some pharmacy namin konkofa a drone woho and I say some pharmacy no and delivers a drone to me fee because of the property addressing system. So you see the comprehensive plan that we put in place. Yes, see, we are bringing healthcare access to the doorstep of the people. And you're launching telehealth. Telehealth, where ubet me at now fee, ubet me at now office, ubet me at any location, approach we are. Now, doctor, ewa hase. Doctor ni wiye na doctor na throw dry the amount. Na drone ya the amount pharmacy no. Na pharmacy na deliver drone to ufie. Abrochire na abagana no. So you see, your program is very comprehensive and it's thought through. It links with the economic model and it links with the supply chain and all the models together. So if you look at the NHIS, we say now, I mean, just some few about 4 or 5 points per hour. But it's very detailed. Just say, if
the NDC should, for example, say, Sisi and I will say you've been capped to say 20%, and it's almost your margin said yeah, promise, almost first promise in the manifesto, they can say they would uncap the NHI levy and ensure timely release payment to service providers. So I'm on capping in 100%. Now I'm this 20% ne koto sa Mahama Cares fund anymore. Will it be okay with you? And officer still
why would you separate the funds? You can say what separate funds. Yeah, they are charity in a your separate fund.
Sure.
So that they support with maybe the video manifesto, maybe this almost just here. I'm being honest. I believe within my spirit and my soul that because you see, if you do that, you'll be like I'm saying. This is an economic model. You don't just say you are just going to set up a fund to support. Meanwhile, you have what vertical funding.
Yeah.
So you have a fund already. That fund do have a source of funds from the NHIL and the SNCs. And I want some premiums I had count.
Yes.
So what I say.
Yes.
And if you are going to set up a different fund, you have to tell us the source of funds. For that Mahama care. And that funds, will it be in competition with the NHIS funds or not? So the best thing they have done, like you rightly said, both manifestos are on capping at 100%. Perfect. I wouldn't have the problem.
Yes.
But really, you have a separate fund. Dramatic. But you even confuse patients. Into Shobiko Hospital already in dialysis, you cover some of the chronic diseases. In 2% say or hospital or no funds no or Jeffrey Mahama care funds no and also Jeffrey NHIS funds no. There will be a whole lot of complications, I'm telling you. And I think they have to sit down and analyze it carefully. I'm doing critical analysis here as a professional, and I believe that they have to rethink their manifesto.
Yeah, but beyond even the Mahama cares, they are promising free primary health care and also.
Ah, my God. What is free primary health care? Free primary health care, Ghana do have one of the best primary health cares that you can ever have, the chips.
Yeah,
and now we are modernizing the chips through the network of practice. You see, Onya, I'm being honest with you. I think that I have a big problem with the way they've written their manifesto. And it's not, I'm not using political lens, I'm using professional lens. And they have to rethink. You see, primary health care do have components. So let them define primary health care. And when you define primary health care, you understand. Primary health, in fact, 95% of the diseases that NHIS covering now are primary health care diseases. So what are you talking about?
Almost say,
I don't know who advised them, but I believe that they have to rethink their health manifesto. Primary health care have components. It have the prevention, it have the curative, it have the other components. So which one are they talking about? Are they going to collapse the NHIS? They should let us know. I'm being honest.
Yes, so almost say implement free primary health care from the CHIPS compound to the polyclinic level in the short to medium term.
Onuya. So are you saying that all those that's being funded by NHIS? So are we not already implementing that? Is it not free? 95% of the disease burdens. So the problem now is that we need systems reforms.
Asempa
How do we stop co-payment? I've given you the solution. How do we make sure that we get the monies on time? I've given you the solution because the complications, some consolidated account, answer the Minister of Finance, I issue warrant, answer the controller, I transfer Canada. All those processes must stop. And then MPP capture one manifesto anymore. Oh, so once you put the system, facilities now, they will tell you, say, our biggest problem is delays in funds, receiving of the funds.
Yes.
So see, current government, no, but we are even going a step further in the manifesto saying that we need to reform the way scanner ever NHIS for.
Because you see, as only kidney patients needing come fear and say yes, I pledge, NHIS be take over from the 1st of December. By a fear and say biana sikana nko facilities ne ho. Amoma anya bia nto consumables na no so kwa complications bebre aba. Assurance be na odbe ma omo. They are listening to you all over the country. Assurance be na
odbe. Yes, starting this pilot the financing model was different. In fact, we gave them what we call the global budget. And the global budget, we even asked them that patients are almost training on omunyeden, omunfa omuskanyeden, ema omu. Yes, starting benefiting. What's the problem? We say problem biaba. Until say, I think that Kolebu in a heavy haze kakra, they were consumables. What pot no? Went me a news today. That had nothing to do with fund now because Kolebu, as we speak, excess funds they are accounting for it. So I want to assure omo kidney dialysis so any the entire Ghanaian population say omo sabeka scan facilities ne sabeka scan amoma ye de omo ye no ya ye actually as ma cost bibia is fine. And I can tell you say the presidential candidate of the New Patriotic Party, Dr. Mohamed Baumia, unimniaoye. I'm being honest, and our advisors know we know exactly the things that we are doing. And see, all that I will say is media me believe is this comprehensive plan now my ebema NHIS no ayeden enya hoden, because bear in mind say more recently Osha in our tenure no we have added more complex diseases on the NHIS than any other government in the Fourth Republic, yet we've been able to pay up to date to the extent that we are even begging facilities to bring the claims. And see, you have to know say something good is happening. In fact, our health system is on an upward trajectory. It's on an upgrade trajectory, and this is where we need to every Ghanaian need to support the national health insurance. I can tell you, say, within our 20-year history, if you look at the data, we are at our best.
Asempa.
Indeed, you are saying, say your name, say by law, no, there will be, you know, a kakakra because of the time frame. In Tibia, 3 months be there, will come now 2 months and now 1 month. Sisi, no more saying a work him.
In fact, let me tell you something. You see, what is happening is facilities near almost 3 months window, almost of it.
Yes.
If you know the normal, I know you're friend within range, no.
Sure.
But here, I know, facilities need to be submitted almost October. Any way there, to see it. Since I'm catching yourself, we share report, no. You are about 50 million, you are here. But you're trying it through 150, another 200, and near here. Because, I mean, you don't pay it in pieces. But you see, you need facilities, Nika. But ideally, the minimum we need 3 months because facilities don't have to submit. Anthony process it and but the Nanado's government and the Dr. Mohamed Baumia's government, almost in advance. We see that in our 20-year history. So that's why I'm saying that something new is happening in the NHIS. The transformation is massive.
Doc, ma yenase na yenhwem fancy enim se mo ye campaign ya me adom na ubedum kran na yate won kan ya hwe na yase adi nkomo bio why
mpacho me da se echiaga na fo nyina
omoje wo so in the Dr. Aboagye Da-Costa or the CEO of the National Health Insurance Authority omo ne manage the National Health Insurance Scheme and motesi ene no AD enkomo. Yes, President